morning, colleagues. Again, hope you've managed to have a bit of a break between sessions. This one is focused on our new imperative for care post-COVID and whether councils can meet the digital expectations of indeed those we serve, our colleagues who work in social care. We know that society is increasingly digitalised and connected with digital equipment, digital algorithms, digital methods of interaction, mediating much of people's lives. COVID, of course, in care has meant that so many more people have an understanding of and direct experience of using digital forms of interaction in living their lives. Digital, from virtual touching to virtual consultations, interactions with professionals and organisations. Digital is something that has played a key role in uniting us as individuals, as families, as communities, and indeed as society during this pandemic. And how we co-produce with the people we serve, how we engage our frontline colleagues and the expertise that they bring, and how we move forward to harness, exploit, scale up, and deploy technological innovation and digital solutions to care is one of the key areas that ADASS is particularly keen to ensure that any reform of social care takes cognizance of. So this morning's sessions, you can see my three colleagues who are going to be presenting today. Today we're going to hear really a combined effort, I think, from Hampshire County Council and PA Consulting about a really exciting initiative that council with PA Consulting has undertaken. We've got Steve Careful, he's just going to wave his hand from PA Consulting. We've got Leslie Grant, also from PA Consulting, and we've got Mark Allen from Hampshire County Council joining us. So by the way of introduction, I know that I will be handing over first to Steve to lead this session. Thank you, Steve.
Okay. Thank you, Carol, and welcome everybody. Thank you for joining us in this session. As Carol said, I'm Steve Careful. I'm a director with PA Consulting, and I'm the Argenti Programme Director for the Care Technology Partnership we run with Hampshire and also with Barnet, Dorset and part of Essex. We've already introduced my colleague Leslie and Mark from Hampshire. We also have another colleague, Robert, who will be joining us later to help with the Q&A. I'm particularly pleased that Carol's chairing this session because the piece of work used to exemplify our proposition today it actually has its roots back in some work we did with Laura Gaudian and Laura Rice on the Isle of Wight and with Mark Allen in Hampshire back in 2018 when the council secured some LGA funding for digital innovation programmes, and the project was to look at what carers needed to support them in their daily challenges. So we ran workshops and had groups of carers and service users in workshops talking to them about their needs, and it was from that the idea of robotic exoskeletons, of cobots, collaborative robots, which we're going to talk about shortly, initially sprang. Can I have the next slide, please? So the last few months have arguably seen the biggest leap forward in the adoption of technology since the mobile phone, and this change has been felt, as Carol said, across all aspects of life, from the way we shop, exercise, and interact with friends and family, but particularly so in the care sector, which has always relied so much on face-to-face and hands-on engagement, which has been denied to it to a degree over the past 4 months. Have the next slide, please. So technology is being used to better understand how people are and what their needs are. That might be happening formally through things like GP consultations over video link, but informally as well, families engaging with vulnerable loved ones virtually as an alternative to physical visits. And care technology solutions increasingly being deployed to minimise the need to enter the homes of people, for example, those who are shielding. So in Norway, PA is working with the government there on a rollout of medication robots, which reduces the need for visits from care workers. The next slide, please. So much of the technology that we're talking about is very familiar, almost ubiquitous. Wearable devices like Fitbits, home diagnostic devices like blood pressure monitors, Amazon Echo, Google Home, some of which may have been designed and purchased for other purposes like entertainment or environmental control. These are all helping people to manage manage their health, maintain their independence, improve their quality of life, and manage their connectedness with their colleagues, friends, and communities. And newer wearable technologies, such as the collaborative robots, are enhancing carers' ability to actually deliver physical care. Now, when these technologies are used as part of a mainstream part of a social care programme, they can also reduce, delay, or avoid costlier forms of care. This is where it gets interesting for councils and commissioners. So in Hampshire, where we currently have over 12,000 people in receipt of care technology, we recorded net cost efficiencies after all the tech costs were taken account of £3.4 million. So there's a real financial payoff if you get this right. Next slide, please. So our proposal today is that councils can and should go further and faster to leverage the benefits of technology, and that requires a radical rethink, a focus on the purpose of the technology, on being bolder and embracing collaboration. And we think this is really well illustrated by the first ever trial of cobots in the UK care sector, led by Hampshire Council and supported by peer consulting. And we're going to show you a short book about this ground project now. And then we'll hear from my colleague Leslie, who's leading the project on the ground, and from Mark, who's commissioning and has the client perspective on how the Cobots project is going. So can we please run the video?
Has been very actively working in the technology-enabled care space, and we're really keen to innovate in terms of capitalising on the opportunities that we get through the use of different technologies to support people. What we're doing at the moment is a really exciting trial in terms of the use of collaborative robots, cobots for short, which essentially are exoskeletons worn by carers to provide care for people in a range of different settings. That's what we're trialling. We don't quite know what the trial will show us, but we're really excited in terms of what's starting to come through at this very early stage in terms of carers using devices and feeling really supported and enabled in their caring tasks. Now for us, that's vital in terms of the care workforce. It's very precious, it's quite finite, it turns over in terms of people entering and then exiting on a fairly regular basis. We believe that use of this technology will lessen the risk of injury to individuals. That hopefully retains a workforce. It means that there's continuity of care for service users. So those are some of the things that we're hoping to see through this trial. We're not quite sure though where it will end up, but I'm really, really pleased that we're working with our technology partner PA Consulting and the Argenti Partnership to roll out and to test really to the point of what are the opportunities, the use of collaborative robots.
I come in to work, I then go into a locked cupboard where the cobot's kept, and then I make sure I've got a battery that's charged. I then open the back bit where the battery goes, and I've got to make sure I click it in twice to make sure it's on. I then turn it on to make sure it's actually connected, and then I literally put it on. It's really quick to do. It takes me about 10 to 20 seconds to put on.
The task that I find it more helpful wearing it is definitely repositioning residents, rolling, moving position in the bed.
With residents that may need a little bit more support, I feel like I can roll them and support for a lot longer.
I was able to really see a difference, like working with service users, wearing the cobot and not wearing the cobot. So when we were doing heavy moving and handling positions, the support I got from my back was absolutely amazing.
It makes me think about what I'm doing. So if I wasn't wearing this, I would probably outbend or twist in a way that I shouldn't. But to have this on, it's, you know, makes me think actually before I move, how am I going to move first? So if I'm helping someone with socks or shoes, or even just picking something up from the floor, although it takes that few seconds longer, it's doing my body a world of good.
Our first call is normally a wash. We can shower with them. They're waterproof, so it's quite handy when I need to get right down low to do the bottom half of the body.
We've obviously got a lot of service users here that are in wheelchairs. Pushing wheelchairs can obviously cause real pain to your backs. I noticed personally myself when I was pushing a wheelchair, sometimes I had to kind of almost give myself a run up to go, where in the cobot I can just go straight into the push. To show you how it supports us, we've got this little thing, we call it the ragdoll effect. So if Emily sets it to the highest level and then tries to bend down, you can see how the cobot is preventing her going down any further, causing pain to her lower back. So if I now turn the cobot off, you can see how she falls like a rag doll.
The service users have been very, very interested in this piece of equipment. We were a bit worried because some of our residents do have dementia and other conditions. We thought they might be a little bit, apprehensive, a bit nervous, a bit scared, but they've been really interested. They've been asking questions. It's been very positive.
When the residents see this, they're like, oh, it's clever, it's a brilliant idea.
For me, from an OT point of view, if we were delivering care to somebody, it could be that additional tool that we could put in place to enable the care to be delivered in a much more timely, efficient and effective way.
People do feel sometimes that care is a hard task, a hard job with heavy movements, etc. So having a piece of equipment that would look after a care worker, support them in their daily life to prolong their journey in care is a win-win.
The first and second time I wore it, yes, it was weird because obviously I wasn't used to it, but now I'm so comfy with it. It does feel like an exoskeleton. It just feels part of my body.
One of my colleagues actually wore their cobot all day. After her shift, she actually said, I'm ready to do a whole nother shift.
I sleep better because I'm not aching. The whole day hasn't been like weighing down on my shoulders or my back, and it feels good.
Hi, I hope you found that video a useful introduction to the Cobots project, and it helped give you a feel for the cobot technology itself and some of the fantastic feedback from our service users and care workers and other professionals we've been working with. So we've got I know we've got some time at the end to answer any questions you've got about that video. But now I'm just going to talk through some of the 3 principles that Steve outlined at the beginning that we think are essential for councils to take on board as they seek to meet these new digital expectations as a result of the COVID pandemic. The first, and arguably the most important principle, is to start with a purpose. Might sound obvious, but you'd be surprised by how many don't start here. Many start with the tech. We've got so many stories of councils commissioning care technology which never even reaches the homes of the people who benefit from them most. So think about the problems you're seeking to solve, regardless of how big, and the challenges you're seeking to overcome. Don't start with technology. You need to shift focus from specific technologies to the purpose they serve. And that requires an understanding of the outcomes you want to achieve. and then look at the technology and how it can enable those outcomes. And don't rush this bit. I think there's always a temptation to rush it. Take time to understand the biggest challenges you face and speak to the people you want to impact most and who will benefit most. Speak to them at the beginning and speak to them all the way throughout the process. Involve them in the co-design of new services with those people who will be using them most. And after all that, you've got to underpin all of that, focus on the wider value of new digital services and understand the overall return on investment, not just cashable efficiency savings. Think about improvements to the wider society and the value that can bring. I'm now going to hand over to Mark from Hampshire, who we've been working with on the Cobots project. And he's going to explain a bit more about how the project didn't begin with the cobots. It began with the problem they wanted to solve and the outcome they wanted to achieve. We didn't even know cobot technology existed before this. It was only once we understood the challenges and we spoke to the people about their challenges that we began to understand more about what technology would be suitable to help address those. So over to you, Mark.
Thanks, Leslie. I'm going to start. I'm not going to apologise by repeating some of the things you've already heard, because I think some of these lessons and the points made are worth repeating. But I think the really key point for us is to say that actually the purpose is key. We didn't enter this particular project on the basis we wanted to engage some technology. What we actually looked at were we were in a process like everybody within the room here will be looking at and has looked at and will continue to look at after today, is the challenges that face us in terms of being in social care organisations. And they're very significant. And actually, one of the things we wanted to do was to actually understand how we could address those challenges effectively. For us, the key question, and we undertook that with our colleagues in the Isle of Wight initially a few years ago, was to what are the challenges faced by carers? So it was really just a very basic question like that. For us in Hampshire, the work that we had undertaken indicated that within the next 5 years, we're going to be looking at probably a shortfall of around about 6,000 people in caring jobs. And that represents to us a very significant challenge about how we will effectively deliver that, both in terms of home care delivery and residential nursing care sector too. So for us, it was, what do we start to do that? So we began by asking the questions is, how can we actually make the workforce more resilient? How can we help people to work more independently? And what is the role of technology in that? So that sort of comes last. When we were looking at this, we actually came on the idea of using cobotics, and we'll come on to actually how we got there and the process we went through to achieve that. But when we started thinking about how we can use robotics, we were using that in our broader organisational challenges in terms of the AI-type robotics. But for us, we had to come back and start asking the questions again. We're thinking of this. How does this impact on you? We start to get into that circular motion of looking at a solution, rechecking it. Is it the right one? Is this resonating with people? And then we could develop further on. I'll hand back to Leslie now.
Thanks, Mark. The second key principle that's really important is to be bold and adapt, to seek out measures of value for service users and carers. I think, often it requires a real boldness to deploy technology, the courage to experiment, even when the results are completely unknown or uncertain. But I think this does require some frank conversations. And in some instances, let's be honest, digital delivery will reduce the need for human interaction. And we've already seen that now during COVID. I mean, who would have thought we could survive for so long without physical interaction in the workplace? And there are some pilot schemes out there that have shown that some people would rather receive certain aspects of care remotely or from robots. And this has been especially true in COVID in light of social distancing concerns. So let's not see this as something that we should be scared of or avoid. What the reality is what this does is alleviate pressure on the most scarce and valuable resource, which are people, and frees those people up to focus on where they offer most value. And that's what we did in the very early stages of scoping out the cobots. There were many concerns around the role of robots and cobots in replacing humans from many different people, carers, service users, unions. But face those conversations, have them, learn from them, and move on. Also, as I said earlier, think about the biggest problems you've got. Do think big. And remember to look at what you're spending big chunks of money on and where you've got major problems, and try and break it down. Start small and adapt, continually adapt and learn and grow from there. Mark's going to give some examples of how Hampshire has had to be bold, both in their ambition of being the first ever to trial in the UK and European care sector, but also in their need to constantly adapt according to the barriers and the challenges that have come up when we've tried to deploy cobots, both big and small. So Mark, you can give some more information. Thanks.
Okay, thanks. Thanks, Leslie. Yeah, I think the issue for us was the issues that we were facing are very complex. They're big and they're significant. And we are taking a multifaceted approach to a number of those issues. But then there's the opportunity to be bold, and it's really gratifying to work with someone like Graham, who's the key sponsor for this particular project, who is really happy to take those sort of bold and sometimes risky steps. But what that does mean is that you put yourself in the way of challenge. The bold will be challenging for you, because actually what you're doing in those circumstances is challenging established practice often. For us, that was really apparent to begin with, because you say, well, we'll use robots. You start using the term robots and everybody starts to flinch initially. When you actually explain, and you've seen the videos, can you see what they are? They're not scary devices. But it does actually start to question how people deliver care. And what you're asking people to do is to think round an issue that they've been perhaps used to delivering in a particular way for many years. And that will bring challenge to itself. So don't expect to win everyone around in advance. That people will be looking at these things and saying, well, hold on a minute. We work in an environment where people do that quite naturally often. And things like if your plans become overwhelmed by challenges, considerations, take a step back. We often had to do that when we were looking at this. There were challenges from our OT colleagues, from organisations like some of the national organisations saying, well, what are you doing? How's that going to work? Is this really safe? And actually, we were able to take a step back and re-look at this. But we constantly do this in terms of both the basic tech delivery that we do, but any of the innovative programs that we embark on, we constantly step back and say, are we doing something that's more complex than we necessarily need to do? Are we getting caught up in the tech, the excitement of something new and technologically advanced? So ask that question constantly. And we do ask the question, would something simpler and smaller initially allow us to actually break the threshold of being able to progress some of these things? And we did do that initially with this. We actually took small incremental steps to actually introducing these into the workforce and into both different sorts of care settings that enabled us to progress it. So it's actually a fully fledged trial now and showing some good results. So I hand back to Leslie for the next bit.
Thanks, Mark. The third and final principle we want to talk about is collaboration, and to embrace collaboration. I think if there's anything that the COVID pandemic has shown us, is that it's no longer conceivable for one public sector body to operate independently. I mean, the coordinated response from health and social care sectors, working with volunteers, community groups, businesses and charities, has underlined this important truth. So it's so important to collaborate across academia, industry and the public. But collaborate within your organisation as well, across your departments. Pooling resources can help generate scale or funding needed to identify and test new technologies. And working together across councils can have more financial clout and a louder voice. It's also important to look beyond your organisation and beyond the care sector itself. So link up with other organisations in industry and academia, policymakers, SMEs. Not only does this provide you access to new ideas, innovation expertise and technical ingenuity, it also brings a fresh perspective to old challenges. And finally, I think it's important to collaborate with your service users, and this is where councils have a significant advantage. You can offer direct input from end users, whether they're carers or service users, and for industry and developers or academia, this is gold dust. So by working more closely with industry, social care can help drive that those changes and help shape the market in technology development, so ensuring that technology is developed that's fit for purpose. But I think it's easy to talk about collaboration. I think we need to recognise that there's actually a skill in collaborating. You need to be flexible according to the different organisational needs that you're working with. Everyone's coming from a different perspective, with different skills to give and different requirements. So operate a different mindset and actually accept some risk and be prepared to give up some responsibility. Mark's going to give some examples now in the Cobot project of the true breadth of collaboration, both across the globe and the depth within Hampshire, the collaboration that's been required within the departments in Hampshire for the Cobots project.
Thanks again, Leslie. It's an organisation that really does pride itself on its capability to collaborate with others. I think this is one area where actually we did learn lessons, and it was those lessons are very much around the scale and scope of the collaboration required and some of the nature of it. And this has been a project that has required a significant amount of collaboration in different forms. So there was the initial inception of this, which was the collaboration between ourselves and the Isle of Wights and others, the LGA and others, about actually what are the challenges that are facing us and what could we potentially use to start to address some of those challenges. But then they spread out from that, because when we started to think about actually could we use robotics in some way, there was the challenge of actually finding a partner to collaborate with that actually had devices. And as you can see, Cyberdyne is a Japanese company, and we went international on that. That in itself produces some really interesting challenges for us, because there are language challenges, there's financial challenges, there's even legal challenges, because obviously we want to use some of their devices. They operate under Japanese law, we operate under English law. And that was an interesting thing as well. There's a collaboration that has to then take place internally within you as an organisation. So I've just mentioned the issue around legal, but there are procurement issues that are required to be dealt with there. There's the commissioning, the whole commissioning framework. But then it goes beyond that, because what we were looking at here was saying, actually, this isn't about introducing just a new piece of technology. This is about potentially using a piece of technology to help people change the way they deliver care in some way. And that has all sorts of implications. So we then started to think about, who do we need to talk to? So there's Health and Safety Executive, the Care Quality Commission, clearly. But then there's the government bodies that are responsible for some of this. So for us, there was thinking longer term, who would we need to be involved in there? So there's BIS, there's clearly our regulatory, our overall government department, DHSC, and then NHS latterly in terms of the COVID period. But for us, what we wanted to be able to do was to think about this in a more broad sense. We had our own imperatives around helping it, using it to help people deliver care. But then there was the issue around, actually, there's a whole heap of informal carers out there that may benefit from these sorts of things. And what we want to know is what's the view of people who are delivering care in their own homes to their loved ones, or having care delivered to them. And then that brings us on to the last set of people that we needed to collaborate with, which were carer organisations and third sector bodies. So we've been talking to them. We've been talking to them on a national scale through the likes of Carers UK, but also through our local carers networks within Hampshire, about both not just the way of delivering this, but what does it mean for people? How do people see this, and what the opportunities that people may see for us to expand what we do with these devices? And I think One final point that I'll make, and it's one a former chief exec of ours made some time ago, but I think it holds true in these cases. In terms of that collaborative process, you have to think about the notion of giving up some of your sovereignty. Is that you may want to drive something forward, but all of these different bodies will have some level of skin in the game, and that they will want to actually be input into this. So the issue of actually driving it forward, and it's the same for any sort of level of collaboration, is an important thing. So I'll leave it there and hand back to Steve, I think.
Yep, okay. Thank you very much, Mark and Leslie. So the three principles of being purpose-led, being bold, being collaborative are powerfully illustrated, I think, by the Cobots programme. If you'd asked us, would we like to trial these devices in the teeth of a pandemic, we might well have politely declined, but that's where we found ourselves. And in fact, what we saw was that the flexibility of the organisations involved when the crisis struck has enabled us to accelerate the programme and discover more about what an effective Cobot could do to support care delivery. For example, switching the deployment of Cobots away from the residential institutions where we were trialling it initially and into the community where individual carers can wear it and deliver care without having a second carer present, which both improves the resilience of the workforce, but also means the prospect of cross-infection is reduced. Post-COVID, the challenges are clearly huge and many things won't be the same again, but human resilience and our willingness to rapidly adapt to new technologies, which has been demonstrated so clearly through the COVID crisis, have shown there's a real opportunity to embed new ways of working that are more effective and more sustainable. So there's an opportunity to strike while the iron is hot here. Next slide, please. So just to recap, the three principles that we think need to underpin the mainstreaming of care technology, and this doesn't just apply to Cobots. Cobots is a good example, but we've been doing this for years in Hampshire and Barnet and Dorset and Essex to really mainstream care technology and make it just part of the way we do things around here, is to focus on the purpose and the outcomes, be bold and adapt to changing circumstances. Cobot's one example. We've got other examples, for instance, deploying SOS phones at the point of discharge so that people can have a connection to a monitoring centre as they leave hospital, many of them being asked to do that within 2 or 3 hours during the COVID crisis. They left with a device that connected them to a monitoring centre who knew who they were. So really trying to be fleet of foot and make sure people had the support they needed in that crisis period. And thirdly, to collaborate across departments, academia, industry and the public. And as Leslie said, to cast that net wide because you learn all kinds of interesting things. We run a robotics and care community of interest, and we've taken that group around to different places, including the Imperial College Robotics Lab in London, where academics and commissioners were able to talk about what they were each doing, and light bulbs were coming on all around the room in terms of making connections about what the needs were, what the challenges and the outcomes needed in care were, and what the kind of technology solutions were that were in the pipeline that could be brought together to address some of those changes. So cast that net widely. Okay, next slide, please. So that's the end of the formal presentation. I think we've got about 10 minutes or so for questions. I know there have been some questions coming in. If you want to discuss our approach to the Cobots project or to any other aspect of care technology, then contact us using the email addresses on the slide or through the networking systems in the conference. And similarly, if you want to speak to Mark about the experience of Hampshire County Council, his address is on there. So I'm going to hand over now to Robert, who is going to help us just manage as many questions as we can. You have all got the Slido app, which does allow you to submit questions. So if you haven't done yet, please do. But also, we're around for the rest of the conference and happy to take questions at any point in the future.